Welcome to class, students. Today, we'll be considering a very important topic titled Introduction to Cardiopulmonary Resuscitation. Introduction to Cardiopulmonary Resuscitation, also referred to as CPR. Introduction. CPR is a critical life-saving technique implemented when an individual's breathing or heartbeat assist. The primary goal of CPR is to maintain oxygenated blood circulation to the brain and other vital organs until professional medical assistance becomes available. CPR consists of rhythmic chest compression combined with rescue breath. Importance of CPR: it is essential for blood circulation, oxygen delivery, enhanced survival rate and interim support. For blood circulation, CPR, particularly chest compression, assists in pumping blood throughout the body, ensuring vital organs including the brain receive necessary blood. Then another importance of CPR is oxygen delivery. By maintaining blood circulation, CPR ensures oxygenated blood reaches the brain and other organs, preventing permanent damage. We also have enhanced survival rate. When CPR is administered promptly and correctly, CPR can double or triple survival chances following the cardiac arrest. So CPR is very essential because it helps to increase survival rates following cardiac arrest. Cardiac arrest can be so very terrible, and it is very essential to be able to, as a first aider, to be able to know the CPR techniques in order to increase the survival rate of victims involved in cardiac arrest, or people victims that have stopped breathing. Yeah, it's very essential. Another is interim support. CPR provides crucial time for emergency responders to arrive and implement advanced medical interventions such as defibrillation. I'll take that again. I said CPR provides crucial time for emergency responders to arrive and implement advanced medical intervention such as defibrillation. Another essential procedure for CPR is emergency notification. For an unresponsive person, immediately contact emergency service within your environment. Another is environmental assessment. Verify the area is safe for both rescuer and the victim. So essential procedures for CPR is, first, number one, your emergency notification if the person is unresponsive. The another one is environmental assessment. Assess the environment in the case of accident or a situation when the victim is being shot down, or just first of all you need to assess the place, if the place is very safe for both you, the rescuer, and the victim. Another is breathing verification. Observe, listen and feel for breathing indicators. Chest compression. Position hands centrally on the victim's chest and apply firm, rapid downward pressure. Rescue breathing. If trained, administer 2 rescue breaths after every 30 compression. Another is continuous application. Maintain the cycle of chest compression and rescue breath until professional help arrive or the person shows signs of recovery. We have CPR guideline for the American Health Association. For untrained individual, if you lack CPR training or prefer not to perform mouth to mouth contact, Implement hands-only CPR. Compress the center of the chest firmly and rapidly at a rate of 100 to 120 compression per minute until medical assistance arrives. No mouth-to-mouth contact is necessary for rescue breathing. So it's not essential that you do mouth-to-mouth contact to rescue the breathing of the victim. You can also do chest compression of the person. That's 100 to 120 chest compression. We see how it's being done with the images being displayed on the slide. For trained or confident responders, when you are well trained and confident in your abilities, assess for pulse and breathing. If neither is detected within 10 seconds, begin CPR with 30 chest compression followed by 2 rescue breaths. Continue this compression breath cycle until professional help arrives. For previously trained but rusty responders, if you had CPR training but feel uncertain about your skills, focus on delivering chest compression at a rate of 100 to 120 per minute until help arrives. These guidelines apply to adults, to children and infants, but not to newborns like babies that are under 4 weeks old. CPR maintains oxygen-rich blood flow to the brain and vital organs until emergency treatment can restore health heart functions. Without this oxygen supply, brain damage can occur within minutes of cardiac arrest. Emergency assistance if untrained but with phone access, call 911 before starting CPR. I guess now I don't know if 911 is generally for everyone, but call an emergency healthcare if within your environment, within your community, in order to help the victim. The departure can provide instruction until help arrive. For proper CPR training, take an accredited first aid course that includes CPR and EAD instruction. Before performing CPR, check the following: is the environment safe? Is the person conscious? If apparently unconscious, tap their shoulder and loudly ask, "Are you okay?" If there is no response and someone else is present, have them call 911 and locate an EAD while you begin CPR. If alone with phone, access. If alone with phone access, call 911 before starting CPR and get an EAD if available. Is automated external defibrillator. That is, EAD is automated external defibrillator. You can use that too. If alone with phone, okay, I said that earlier. When an EAD becomes available, deliver one shock. If instructed, then resume your CPR. The CAB method of CPR. Remember your CAB method of CPR when you're on the field. The American Heart Association promotes the CAB acronym to help people recall the correct sequence for performing CPR. C is compressions, A is airway, B is breathing. Then we also have another C, which is restoring blood circulation. So look at how CPR is being performed. You can see where your heart is. So this is a typical example of CPR compression as seen on the slide. Compression, CPR compression are the most critical component. Now, compression are the most critical component of CPR. Follow this step position. Follow this step Position the victim's supine on a firm surface. Place your lower palms centrally on the chest between the nipples. Position your second hand on top of the first, keeping elbows straight and shoulders directly above your hands. Compress the chest downwards between 2 inches, that is 5 centimeters, and 2.5 inches, that is 6 centimeters. Use your body weight, not just an arm strength. Maintain a rate of 100 to 120 compression per minute, making the tempo of staying alive. Allow complete chest recoil after each compression. If untrained, continue compression until movement signs appear or professional arrives. If trained, proceed to airway management after 30. Look at an airway establish an open air passage. Look at how it's being done in the next slide. Then for airway that is establishing an open air passage. After 30 chest compression, open the airway using the head tilt chin lift technique. Place one palm on the forehead, gently tilt the head backward with other hand, lift the chin forward to the opening. Then the B is the providing oxygen. Rescue breathing can be performed mouth to mouth or mouth to nose if mouth access restricted. Current guidelines recommended using a back mask device with HEPA filter when available. After opening the airway for mouth to mouth breathing, pitch the noses closed and create a seal over the person's mouth. Deliver 1 second 1 breath and observe for chest rise. If the chest arises or rises, provide a second breath. B stands for breathing, providing oxygen. If no chest rise occurs, readjust the held seat, chin lift position and attempt another breath. Each cycle consists of 30 chest compressions followed by 2 rescue breaths. When an EAD becomes available, follow its instruction. Deliver 1 shock, then resume compression for 2 minutes before the next shock. Continue CPR until signs of movement appear or emergency responders take over. For pediatric CPR instruction, that is CPR for children within the age of 1 through to puberty stage, the procedure for performing CPR on a child follows the same CAB sequence as an adult CPR. The American Heart Association provides specific guidelines for pediatric. If alone and do not witness the collapse, see for compression, restoring blood circulation. Begin chest compression immediately. Continue for approximately 2 minutes, then call 911 and locate an EAD if available. If alone and witness the collapse, call 911 first, then obtain an EAD if available, then begin CPR. So look at the compression techniques being set. Position the child supine on a firm surface, kneel beside the child. Place 2 hands on the lower half of the breastbone. Compress straight down 1 to 2 inches. Maintain rate of 100 to 120 compression and so forth. So distinguishing between CPR and first aid in terms of scope, different objectives, and thank you very much for listening.